Okay, the topic under discussion is endocarditis. Itis mean inflammation. Endocarditis means endocarditis is the innermost layer of the heart which is covering the four chambers and the walls of the heart. Four chambers has been covered by a layer called endocardium. Okay, heart has three major layers which are endocardium, which is covered by the layer of these four chambers and also walls. The middle one is myocardium and the outer one is epicardium. Okay, and of all these, a layer called pericardium means the outermost layer which is thick and also covers all the part above all the part of the heart. Okay, pericardium, which consists of pericardial fluid. We have already learnt in our previous classes, okay, in CAD and also in cardiomyopathy and also myocardial infarction. Okay, which consists of pericardial fluid. Any friction, any forces, any accident which happened to the chest, these pericardial fluid, and also being the heart in the center of the thoracic cavity, the ribs acts as a cage to protect the heart from any injuries, and also this pericardial fluid doesn't allow any infections to go inside the heart, and also it will protect from any injuries also. Okay, inflammation to the endocarditis means inner layer of the heart. Okay, how does it gets inflamed? When any part of the body is infected with the germs or any infection, okay, that infection will go through the bloodstream. That infection will be carried through the bloodstream, and also it is carried to the heart. How it is carried to the heart? Where we have studied that in the part of the anatomy of the heart, the inferior and also the superior vena cava will brings the deoxygenated from the blood from the different organs of the body, no? As well, when the body part is affected with any infection or any germs, okay, the infected blood will be carried to the heart, then the heart gets infected, okay, or inflamed. Okay, and also the heart muscles becomes very hard, and also the pumping and the mechanism will also become very slow. If the pumping or the mechanism is slow, the output which is there means the pulse rate or the BP will be reduced slowly. The obstruction, and see here are some bacteria or any germs. Blood is flowing to the heart. These are lower limbs. If you think these are lower limbs, the veins are carrying the blood, okay, deoxygenated blood. These germs will also germs will also be sent through the heart, okay, through the blood stream, okay, and these can affect the heart and also can lead to endocarditis. This is also a main reason, and also inflammation in which the heart cannot pump, and also then when electrical impulses are not sending any signals to the heart, then the heart movement will also reduce. After reducing the heart mechanism, the oxygenated blood flow to the tissues of the heart will also reduces. Okay, if there is lack of oxygenated blood, if there is lack of oxygen in the tissues of the heart muscles become rigid or tightening, and also the tissues get died, okay, and also the discolorization of the tissues can take place, means death of tissues, necrosis can lead.